Hello, namaste, welcome back to our channel. My dear student, today topic about postpartum hemorrhage. I would like to tell about what is the meaning of postnatal and what is the meaning of antenatal and what is the meaning of internatal. As we know that for every woman, pregnancy we are separated into three kinds of the categories. Whereas the first category is called as antenatal, the time duration in between the conception to delivery. Whereas during the delivery, during the labor time duration is called as internatal. Whereas after delivery, after labor process, the time duration about 6 weeks is called as postnatal. So there are the three categories of the stages of a process is there: antenatal, internatal, postnatal. My dear students, this is one of the gynecological complaints and this is a gynecological disorder. This is about the problem, the complication during the postnatal. After the delivery, the complication we can able to see, that is called as hemorrhage. So following the delivery, so hemorrhage will be happen. That is the condition is called as postpartum hemorrhage. Let's see what is the meaning of postpartum hemorrhage. So here it is telling in our old about 2 lakhs of the women's dies because of PPH. We can call it as PPH as a postpartum hemorrhage. So here it is telling, so because of PPH, about 2 lakhs of the women are dies every year. In that case, you need to think it's not a common problem, it's a very severe problem. Where you can see in our India, about 35 to 56% of the death rate we can see, that is called as maternal mortality. We can able to find maternal mortality rate in our India, 35 to 56% of the maternal where they are dying because of PPH. That's what we need to get somewhat knowledge. What is the meaning of PPH? Here it is telling, so after the delivery, after the labor process, the amount of the blood will lose. That is a common, as we know that. Whereas if it is the losing of the blood, if the bleeding of the this postpartum above the normal, in the sense, so blood lose greater than or equal to about 500 ml. If it is 500 ml, it we can call as okay normal. Where it is above the 500 ml within 24 hours, that will be called as primary PPH. Whereas still after 1 hour of the baby delivery also, still the bleeding is occur. So about 1000 ml, about 2000 ml, it's like after 24 hours also. That will be called as secondary PPH. So here what is the exact point what I am trying to say? So PPH is nothing but after the delivery process where the blood loss occur. If it is within 24 hours, that will be called as primary PPH. If it is after 24 hours, still there is a hemorrhage is getting, that will be called as secondary PPH. Let's see in detail. So what is the differentiation in between primary PPH and secondary PPH? So primary PPH, as I told you, so that the bleeding will occur within the 24 hours after the delivery, that will be called as primary PPH. And this is the main reason for the getting of primary PPH, atony of the uterus. So what is the meaning of atony of the uterus? As we know that atony is nothing but absence of contraction. Usually the uterus might be get this contraction relaxation during the labor process. Whereas after delivery also, the uterus need to be the get the relaxation and contraction. Then only the bleeding can stop. Whereas in the case of primary PPH, the atony, the absence of contraction may occur, that will be called as primary PPH major cause. Whereas secondary PPH, as I told you, the bleeding will occur after 24 hours following the delivery till 6 weeks of the postnatal duration time, that will be called as secondary PPH. Let's see what are the major causes for getting this PPH. The first one is, as I told you, atony is nothing but uterine absence of contraction. And next one is tissue, nothing but retained placenta. We know that the placental separation, the detachment of the placenta or placenta expulsion may occur during the third stage of the labor. If we are not doing perfectly the detachment of the placenta, it is leads to the PPH. That is one of the cause. And next one is the trauma, laceration or uterine rupture may chance to get the PPH. And last one is clotting, means this is one of the complication, coagulopathy. So clotting factors, if there is some abnormality, in that case the bleeding will occur continuously. So these are the 4 T's we can call as major causes of PPH. So this is about causes. Let's see what are the symptoms. What kind of the signs and symptoms we can see for the postnatal PPH mother. So pallor is the one thing. Pallor is nothing but when there is a bleeded much more, then the pale color we can see, and tachycardia, nothing but heart rate is getting more than normal, like. And next one is hypotension, the blood pressure BP is decreasing. An altered level of conscious, is she is going for somewhat unconscious or semi-conscious. Restlessness, she can't feel some good. Next one is drowsiness. Next one is maternal collapse. So these are the some kind of the signs and symptoms or complications we can able to see when the mother on PPH time. And what is the main surgical procedure for the PPH? If continuously the PPH is getting, it's not recovering, so what is the final ultimate thing? That is nothing but hysterectomy. So hysterectomy is a surgical procedure where we can do in the case of maternal complication, in the case of maternal life threatening condition. So still she is a life threatening condition, in that case we can do one surgical operation, that is overall cutting and removing of the surgical procedure name is called as hysterectomy. So hysterectomy is one of the surgical procedure we are using in the India. So this is about today's session. My dear student, today I have discussed about what is the meaning of PPH, postpartum hemorrhage, and what are the types of PPH, what are the symptoms and signs of the PPH, and what kind of the management we can able to find for the PPH. That's about today's session. Please like and share and subscribe. Don't forget to comment. So I will come with next session with new topic. Until then, stay tuned. Thank you so much, my dear students.